Hi, I'm Dr. Nowrin. I'm a GP at Woodside Medical Centre. Today, we're going to be doing a demonstration on how to do a breast examination. So, with a breast examination, you've got to remember that it's important for both men and women to do breast examination because breast cancer can affect men as well. It is rare, but if men have breast cancer, it's more likely to be aggressive. So therefore, it's really important for men to examine too. So when we talk about breast examination, sometimes people ask, is there a good time to do it? When should I do it? The answer is you can do it anytime. But if you are a lady that is menstruating, the best time to do it is actually a week after your period has finished. The reason for that is that your hormone levels are starting to settle, so it's the best time to do a breast examination. Remember, no two breasts are the same, and that includes on the same person. So the reason that it's important to do regular breast examinations is so that you know what your normal is. When you know what your normal is, when something isn't normal, you'll be able to kind of tell and know that, hang on, that was different, that wasn't there last month. So really important to do regular breast examinations and know your breasts. So what I'm going to do now is to show you actually how to do a breast examination. Okay. So when we look at the breasts, the first thing to do is actually stand in front of a mirror so you know what your breasts actually look like. Look at the skin, look at the nipple. Has your nipple always been, does it always stick out? Has it always been in? And so if your nipple changes from in to out or out to in, or you notice that there's dimpling in your skin, you notice that, there's any changes, redness on the skin, that's something to kind of discuss with your doctor. So when you've looked, just standing in front of the mirror, the next thing to do is actually just bend forward slightly. When you bend forward, that will change the position of your breasts. So if you've got your hands on your hips and just bend forward, that will enable you to be able to just look at your breasts. So when you've had a look, think of the breasts as 4 sections. So you're kind of dividing it down the middle and across, and then you've got the nipple area. Don't forget, the breast also includes this area here. This is the tail of the breast and falls into this quarter. So really important to include that when you're examining your breast. Then when you've got your underarms, imagine it as a pyramid. So you've got right the middle of your underarm is the tip of the pyramid, and then you go round. So that and that's quite deep. So when you're examining under your arm, you can place your hand over the back of your head, and then you are basically putting your hand right into the middle of that pyramid. So right into the middle of the pyramid, and then press and examine all the way around that pyramid to make sure that you can examine. And what you're checking there for is your lymph nodes, because the breast drains into that particular area. So sometimes you may not notice anything in the breast, but you may find something in the underarm. If you do, again, that would be a reason to go and see your doctor. So then it comes to the actual breast examination. So I'm just going to move this forward a little bit. So when you are examining your breasts, the best thing to do is to put your hand over your head, because that will stretch the breast tissue and make it easier, so it's flattening it against your chest wall. Sorry, I'm just going to move to the other side. So then what you're doing is 3 fingers, and you're using the fingertips. And like I said, imagine the 4 quarters, and then you've got your nipple. So it is using your fingers. It doesn't really matter which area you start in, but just make sure that you get all 4 areas. So it is circular motions, and you are pushing with your fingers onto the chest wall. So you're basically using the breast onto the chest wall and feeling with your fingers, and it is that circular motion, making sure you get all 4 sections of your breast. And then, as I mentioned, don't forget the tail of the breast as well. So once you've kind of done that and examined, make sure you're going around the nipple as well, because sometimes we can kind of just miss the nipple area. But again, you're pressing with your fingers. Then also important to check for any discharge. So that is just simply by just squeezing the nipple. If you notice any discharge, it is green, yellow, clear. Really important, again, to check that out with your doctor. So so important things are: do it regularly, know your norm, know what is, so that you know when things have changed, and then remember, just think about the breast as 4 sections, and then your nipple, and then you've got your underarm, which is your pyramid. And that's how you would examine, and do that regularly. If you notice any differences, any changes, you're not sure, you're worried, please go and get checked out with a doctor.